With the language in this amendment, the providers who perform the abortion and the complications that occur cannot and will not be held responsible. My name is Dr. Karen Voegtle, and I am a board-certified OBGYN, practicing in the St. Louis area for over 25 years. Throughout my career, I've had the privilege of caring for women in all aspects of their healthcare needs. This has included basic women's health, birth control, pregnancy, menopause, all facets of women's lives. Recently, I've been inundated with concerns and questions from my patients, especially as it relates to specific women's healthcare needs. My patients have heard from the news, social media, and other sources that due to changes in Missouri law, their reproductive health is in danger. They have heard that in Missouri, they could face obstacles in obtaining birth control, such as IUDs. They have heard that if they face infertility issues, they will not have the ability to obtain treatments. They have heard that they could die from a miscarriage or an ectopic pregnancy that we as OBGYNs would be prevented from treating. I reassure my patients that these misconceptions about the current state in women's healthcare in Missouri are just not true. As for access to birth control, I'm able to prescribe and make available many options, such as birth control pills and IUDs. There is nothing in Missouri law that has limited or changed my ability to offer and prescribe birth control to my patients. Furthermore, in Missouri, there are no limitations on access to fertility treatments, medications we can offer, or referrals for in vitro fertilization. The laws do not hamper these options for women in Missouri, and the Missouri laws have not changed my ability to provide these options to families. We've been told that Missouri laws prevent proper treatment for women who are experiencing a miscarriage. In the case of a miscarriage, where the embryo or fetus has no heartbeat and the pregnancy has failed, we can treat our patients with either medication or surgical intervention, such as a D&C. This has not changed at all. The same holds true for treating women with an ectopic pregnancy. Ectopic pregnancies occur when the baby is developing outside of the uterus, and this situation can be life-threatening for the mother. Please be assured that we can and will treat these women, either medically or surgically, whatever is required. There is a misconception that the law has somehow limited our options and ability to treat miscarriages and ectopic pregnancies, and this is just not factual. Our abilities as doctors to treat women are not restricted. Current Missouri laws allow for all the protection these women need in these situations. We do not need to amend our Constitution to protect what is already in place. Throughout my years as an OBGYN, I have seen firsthand women's experiences with abortion and loss. It is always difficult. The majority of the time, abortions are early in pregnancy. Unfortunately, though, this is not always the case. I have seen abortions performed in the second and third trimesters for numerous indications not related to the health of the mother or the baby. Although we would hope that these instances are rare, they most certainly do occur. The amendment language states that we can pass laws prohibiting these late-term abortions after fetal viability, but if you read closely, there are terms such as without the application of extraordinary medical measures and good faith judgment. These terms basically mean that Amendment 3 will allow for abortions through all 9 months of pregnancy in the state of Missouri. There are other provisions within Amendment 3 that are extremely concerning to me as a physician. Amendment 3 states, "Nor shall any person assisting a person in exercising their right to reproductive freedom with that person's consent be penalized, prosecuted, or otherwise subjected to adverse action for doing so." What this means is that anyone, not just licensed physicians or regulated healthcare providers, can not only offer numerous reproductive services such as abortions at any time during pregnancy, but cannot be held responsible or sued for complications or malpractice. Throughout my career, I have unfortunately seen numerous women with incomplete abortions and abortion complications that cannot return to the abortion provider and are seen in emergency rooms or in my office. As an OBGYN, I am committed to caring for women and their unborn babies. Women in Missouri deserve access to women's health care, and they deserve to be protected from reckless or dangerous care. Amendment 3 is not needed to ensure that women receive access to birth control, miscarriage, ectopic, or fertility treatments. This already exists in Missouri, and it definitely does not offer women in Missouri protection from potential dangerous and harmful medical care. Vote no on Amendment 3.